Hi, I'm Dr. Jamie Hernandez. I'm a joint replacement surgeon at the Southern California Orthopedic Institute. I specialize in hip and knee replacement, and in this video we'll be talking about hip arthritis and hip replacement through the direct anterior approach. Alright, so here we have a model of a hip, and the hip is pretty simple. It's a ball and a socket joint. So in the normal hip, this ball fits perfectly in this socket, and there's a nice cushion of cartilage padding between the ball and the socket. So normally the hip moves nicely and has good motion and smooth motion, and there's no pain. The problem is osteoarthritis, which affects millions of people. Over time, with regular wear and tear, this cartilage padding wears out, and then this ball no longer fits perfectly, and the bones start grinding, causing pain. Patients usually notice osteoarthritis of the hip through pain. Pain is the main symptom. So the pain usually occurs at the front of the hip, in the groin. The pain can also occur throughout the entire hip with activities such as getting into and out of a car, tying shoes, and when the arthritis is severe enough, even with things just like walking. So the way to treat hip arthritis, first off, is with anti-inflammatories, injections. We can inject cortisone into the hip. That's like pouring a bottle of Motrin right into the hip socket. Physical therapy, and eventually, when the padding is totally worn out, the bones are grinding, the pain is so severe, the next step is a hip replacement. The good news is that hip replacement is a very successful operation, and we continue to improve hip replacement with advances in the models, the types of implants that we use. And more recently, there's been a big development in hip replacement by the way we actually get to the hip. So a new approach to doing hip replacement is doing hip replacement through the front of the hip. The reason to do that is because when you go through the front of the hip, it's the only way to get to the hip socket without cutting muscles. So that's the way that I like to do it. So whenever possible, we just spread the muscles apart in the front of the hip to get to work on the hip. Because no muscles are cut and damaged, the patient has a faster recovery. The other nice thing about not cutting muscles is that we lessen the chance of a complication in hip replacement, and that's hip dislocation. So one of the problems after hip replacement is that the hip can pop out of the socket, and the ball can pop out of the socket, which is very painful, a very disastrous complication. So since these muscles aren't not cut during this direct anterior approach, the parts are held tighter together, and there's less chance of the hip popping out of the socket. There's such a low chance of that happening that the patient is allowed to do whatever they want after surgery. So with my style, this direct anterior approach, we allow our patients to bend their legs, twist their legs, sit on low seats, squat. They have no rules. In surgery, what we do is, first off, we go through the front of the hip and not cut any muscles, and then we shave out that rough socket. This is where all that worn out cartilage is. We remove all of that and we put in this new smooth socket. So this is a metal cup with a plastic liner inside of it, and now this socket is nice and smooth. The next step is to remove this rough ball and then put in a new ball. And usually I use a ceramic ball here because the ceramics last a long time and are very smooth. We also use newer type implants like this that are curved that allow me to slip it in through the front of the patient's hip, again, not damaging any muscles. So this part goes into the femur. We have a new ball, a new socket, and the patient is off and going. And again, because this surgery is done through the front of the hip, there are no rules. The patient can twist, turn, lie on their side, no restrictions. Usually it's about a day or two in the hospital, And then by 3 months, the patient is enjoying life and has returned to full activities. If all goes as planned, this should last 30 years and provide the patient with a hip that will not restrict them in any way. So for more information on this direct anterior hip replacement, please visit our website, scoi.com, SCOI, for more information. Thank you.